Hi, can I come in?
Yeah.
My name is Desiree and I'm going to be your nurse today. Are you here for your musculoskeletal assessment?
Yes.
Okay, I'm going to start off by asking you a few questions. Have you had any recent weight gain?
No.
Difficulty chewing?
No.
Do any of your joints, muscles, or bones throb?
No.
Okay, and as for your past history, have you ever had any injuries to your muscle, joints, or bones?
No.
Any past surgeries?
No.
Are you on any medications?
No.
Have you had your polio and tinnitus vaccinations?
I think so.
Okay, we could double check your chart. Have you ever been diagnosed with diabetes?
No.
Lupus?
No.
Sickle cell?
No.
And how old were you when you first began your menstruation?
13? 12, 13.
And as for your family history, has anyone ever been diagnosed with rheumatoid arthritis,
No.
gout,
No.
osteoporosis,
No.
or psoriasis?
No.
And how about tuberculosis?
No.
Okay. And then as for your lifestyle, what kind of activities do you engage in to promote your musculoskeletal health?
Like weightlifting.
Weightlifting?
Yeah. Walking.
That is great activities. And do you currently smoke?
No.
Any alcohol?
No.
Do you drink caffeine?
Yes.
Okay, I will note that down. And do you drink any milk or take calcium supplements?
I drink milk.
Okay, I will note that. And how much time do you spend in the sunlight?
Like daily?
Yeah.
Maybe like an hour?
Okay. And then, do you have any difficulties performing your regular daily activities?
No.
And then your posture is upright and erect. And do you have any body image issues?
No.
Okay, so I'm going to get into your assessment, and we're going to start off by having you stand up and take 10 steps forward and backwards. That way I can assess your gait. Perfect. Okay, there's no leaning from side to side. The gait was straight and no swaying or shuffling. I'm going to go ahead and inspect your neck and jaw area. If you can, I'm going to start by putting my fingers on your temporomandibular joints, and if you can open your jaw and close it. Okay, and then I'm going to inspect the neck area for any inflammation or swelling. And do you have any pain in this area?
No.
Okay, if you can go ahead and touch your left shoulder with your chin.
Right.
Yeah, and then your right shoulder. Perfect. And if you can touch your right ear to your right shoulder, and the same on the other side. Great. And what I'm going to inspect next is your shoulders. Okay, and if you can go ahead and stand up and go ahead and do some arm circles for me.
Forward?
Yeah, and backwards. Okay, shoulders seem good, and you can do lateral arm raises. Okay, and let's move on to your elbows. I'm going to check for swelling, redness, or any masses. Do you have any pain or tenderness in the elbows?
No.
Okay, you could go ahead and do some flexion, extension. Okay, and we will now move on to your wrists. Does this hurt
No.
when I put pressure on your wrists?
No.
No? And how about on the hands and fingers? How does that feel?
Fine.
Okay. Any pain or
No.
tenderness? Okay, go ahead and wiggle your fingers and to your wrist, yes, and flexion and extension. Okay, great. You can go ahead and sit down. And then in order for me to check your hips and knees, I'm going to have you lay down. And I'm going to raise the bed, so you're going to feel the bed going upwards. Okay, so I'm going to get your knee and bend it. And then I'm going to extend it. And then if you can do the same thing here. Okay, and let's put your leg up, and I'm going to cross this leg over this leg. Okay, and the same on this side. Perfect. And then if you can get your toes and stick them out, stick your feet out and wiggle your toes. And then go ahead and circle your ankles. Perfect. And then do you feel any pain or tenderness in the ankles?
No.
And how about the knees?
No.
Okay, you can go ahead and sit up now. All the findings are normal in the musculoskeletal assessment. Patient is healthy, and I do not have any current recommendations.